We looked at the systematic approach of responding to drug information queries. Now, the next learning objective is list the elements and characteristics of effective responses to drug-related queries. You should consider 10 questions before formulating a response. And that's because although the type of requester, query, and setting can vary, the process of formulating responses remains constant. The first question is there a clear understanding of the question or problem? Without clear understanding of the question or problem, wrong information can be sent to the requester. Step 2 and 3 of the systematic approach to responding to a drug information request lead to having a clear understanding of the question. The second question to consider is the correct question being asked? In step 3 of the systematic approach, you have to get enough background information to see where the requester is coming from and what are they really trying to ask. The third question is, why is the question being asked? Why now? For example, is the question academic or is it patient specific? The fourth question is, are the requester's expectations understood? This goes back to first you need to identify who the requester is in order to understand their expectations. If it's a physician, how much information do they want? Do they want a quick response or do they want a very detailed response with all the resources attached to it? And if the requester is a patient, you probably don't want to give them too much details to overwhelm the patient. You can also tailor the response to the level of education of the requester. Question number 5 is, has pertinent patient history and background information been obtained? This helps you tailor the question to patient if the request is patient specific. Question number 6 is, what are the unique circumstances that generated the query? For example, is there a shortage of a drug? If so, you may have a temporary response, and after the shortage is resolved, you can go back to the initial treatment. Question number 7 is, what information is actually needed? This is similar to question number 4 regarding the requester's expectations. As a general rule, you want to avoid unnecessary information. You really just want to include pertinent information. Question number 8 is, what is the information needed and in what format? Is it through a phone call? Is it written through a pamphlet or a handout? You can often document in a note in the patient chart. And of course, the timing. Is it needed in the next 30 minutes, by the end of the day? Do you need it by the end of the month? So these are important things to consider. Question number 9 is, how will the information provided be used or applied? Knowing this can help you put the information in a format that is most useful for the requester. And the final question is, how has the problem or situation been managed to date? Knowing this helps you avoid options that the requester has already tried in the past and didn't work for them. And you can move on to alternative options quicker. Once you have considered those 10 questions and you are ready to provide your response, you should start your response by actually restating the request to remind the requester of what they have actually asked you. During that, you can also identify problems, issues, and circumstances. You should begin the response with an introduction to the topic and systematically present the specific findings. Be succinct with pertinent background information and patient data to avoid overwhelming the requester and ensuring their attention is to the actual response that you found. And then you present your conclusions and recommendations along with pertinent references. Make sure you use clinical reasoning to ensure recommendations are evidence-based and well documented. The documentation also helps you remember everything when you follow up in a later time. Here are some factors to consider when formulating a response. Anytime that the request is patient-specific, you can consider these patient factors in order to tailor your response to that specific patient. Things that you want to think of include demographics. Demographics are things like patient's name, age, height, weight, gender, and ethnicity. You also want to consider patient's problem list, patient's allergies, patient's social history such as alcohol intake, smoking, substance abuse, exposure to environmental or occupational toxins, employment, income, education, religion, travel, diet, physical activity, stress, risky behavior, and compliance with treatment regimen, along with access to health insurance. You also want to consider the patient's chief complaint, HPR or history of present illness, past medical history, and so forth. These are usually available from SOAP notes. More challenging to find in the community setting. So if you are in the community setting, you may have to call physicians or nurses to get the needed information. You also need to consider medication factors. So if you have a drug-related question, you want to make sure that you are looking at the right drug name. You also want to look at the status of the drug. For example, is it an investigational drug? Is it non-prescription drug? Is it a prescription drug? Is it an orphan drug? Is it foreign or complementary substance? For pharmacokinetics properties, you want to look at things like liberation, absorption, distribution, metabolism, and elimination. For indication, typically there are two types of indication. There are FDA approved indication, and there are also off-label use. Those are uses that are not approved by the FDA. You want to make sure that you consider cross reactivity when it comes to allergies or adverse effects. You want to look at contraindication. For drug interactions, you want to consider both a drug-drug interaction as well as drug-food interaction, assuming the drug is orally administered. You want to look at laboratory test interference. Some drugs interfere with certain laboratory tests. Administration is referring to the route of administration. So, is it oral? Is it intramuscular, intravenous, subcutaneous, rectal, etc. And for monitoring parameters, some drugs, but not all, actually need to have therapeutic drug monitoring. So there are target levels for certain medications. And there are also some disease factors that you can consider. So for a specific disease, you want to look at etiology, pathophysiology, clinical findings such as signs and symptoms, laboratory tests, diagnostic studies. And finally, the desired characteristics of a response include timely, and the timeliness of your response depends on the requester's. It could be needed in 30 minutes or by the end of the day or in 30 days, etc. So your response also needs to be accurate and concise. It needs to be well references. Whether the requester asks for references or not, it's a good idea to always document your references for your own protection and also for your own future reference. Your response needs to be complete and current, up to date. And there are also some other characteristics that you can look at.